being brave and sharing your stories about your disease experience. Very powerful. Next, we're going to move into the first session, which is going to be on disease symptoms and their treatments and how they impact the daily lives of patients. So I'd like to introduce our panelists. Trina Harris is a Pemphigus vulgaris patient from the UK. We also have joining us today, Deborah Levinson, and Deborah is a patient with mucous membrane pemphigoid from New York. And we have David Barron, and David is a Pemphigus vulgaris patient from the Chicago area. And then, of course, also joining our panel, we're going to bring back Dr. Payne and Professor Jolie in case there's any questions for them. But welcome, everyone. If you could please turn on your cameras and your mics for this next session. So I have some questions for all of you about your disease symptoms and their treatments and how they impacted your daily lives. While I ask these questions of our panel, we will be polling the attendees with the very same questions. So you'll have an opportunity to answer these questions that we'll be asking the attendees. And this will really help give us an idea of how your symptoms and treatments affected you, so all of you in the audience today. And if you're an attendee who is not a patient, please don't answer these polls and just exit the poll questions. So the first question that I have is going to be for, welcome everybody, is for Trina. And Trina, I'm just curious, of all the symptoms that you experienced because of your condition, can you tell us about the 3 symptoms that have had the most significant impact on your life? And I know you provided us with a few slides. Is it okay if we share those slides?
Yes, of course, no problem.
Okay.
Hi, it's lovely to be here. So the most significant are blisters in my mouth, in my throat, with being diagnosed twice with suspected epiglottitis in the emergency room, basically not being able to breathe. So sudden onset, and it just happens like a light switch going on. The blisters appear and cause difficulty in breathing. Also causes difficulty in swallowing, eating, and even talking. So that's the most significant thing, how it impacts my life.
Wow. Okay. And what about you, David? What can you tell us how the three biggest things that were significant in your life?
Sure. I mean, there's so many symptoms that really, when I'm having a flare, affect my life. But I mean, one of them is fatigue, and that's hard for family or friends to see, and they don't quite understand why I might not be able to make it to social obligations or even some days get off the sofa. But when the fatigue hits, I just have to give into it. Skin lesions are another one. When they get bad, my clothes will stick to them. It makes it difficult to sleep. I have to go through a lot of nonstick bandages to just try to function on a day-to-day basis. And honestly, for me, the worst is always mouth involvement. Even a small lesion makes it very painful to eat or drink, but when I get a number of them, I just have no interest in eating and sometimes have difficulty drinking, to the point where when I had severe mouth involvement in 1 month, I lost almost 45 pounds. And, that's definitely not healthy weight loss. And it's just, your appetite goes away when it's that painful to eat. So it's just, those really affect the day-to-day life.
Yeah, and I would imagine if you were on corticosteroids too, like they probably made you hungry, yet you aren't able to eat, right? So that was probably extremely frustrating, I would imagine.
Absolutely, it's a double-edged sword.
It's a double-edged sword, and we hear people use that term often. It's a double-edged sword, especially with corticosteroids. So thank you for sharing that. How about you, Deborah? Can you tell us about maybe the 3 symptoms that have the most significant impact on your life?
Hi, Mark. Yes, and everybody, and thank you for letting me speak. But hearing my fellow patients, I too feel lucky, very lucky. My disease, I have mucous membrane pemphigoid, and it's confined to my mouth. At its worst, its appearance, my appearance was greatly affected, and that really changed my, I guess, self-confidence. My mouth was so bad when it was at its worst, the first 4 months, and of course the diagnosis took months because they thought it was different infections and fungus infections and the like. And when I was diagnosed, that was at a time when I was having difficulty with an autoimmune disease already, rheumatoid arthritis. So it was just, I think it just was worse by just compounding. Here I am dealing with COPD and now RA, and now this crazy disease that came out of left field, and I couldn't eat. My mouth was like that bright red from like when Halloween candy. That's the way I can best describe it. I don't have pictures. I took so many at the time, I can't find them, and it looks like that candy, that like fangs, those to wear Halloween. And so I would like be walking. I recall like leaving a meeting and just my mouth was bleeding, and there was just no predicting when it would be. I couldn't eat for a very long time. I still, to this day, feel differently about hard food. Like, when I see fresh vegetables or hard food, I flinch. But it's been just in managing my mouth for months and going for cleanings, going for irregular hygiene, which has to be done frequently. Every 3 months, they have to put like a series of like 20 on top and bottom injections to get through a cleaning. And, it's just been challenging, and it's better now. But at its worst, I was very hungry in a very dark place for months and months until, years. And it wasn't until the pandemic that I finally found a good match of treatment protocol for me.
I mean, you're absolutely right. I mean, these diseases just have such a profound effect on all of your lives, and they'll never be the same, right? After you get diagnosed with this disease, your lives will
Never.
So thank you all for those insights. Becky, did you have a follow-up question?
Yeah, you've all described a lot of time that you needed to spend in follow-up care. And I was just wondering, what effect did going to all of those doctor's appointments have on your professional and your work and your family life as well? I mean, it seems like it would take a lot of time away to be able to do that.
Well, I used to be a special needs teacher. I used to teach children. I loved my job. I even did respite for some of the children that I used to teach. Very rewarding, very demanding job. But I had to give it up, and something that I really, really miss. And it makes you feel a failure. I mean, the illness has caused me to be so kind of almost inward looking rather than outward looking, because you worry about the next appointment, you worry about what they're going to say next, you worry about it's causes extreme anxiety, and I just couldn't continue doing the job that I was doing. So I now do a very part-time office-based job, and I really feel that my skills are not being used properly. So it really has impacted my life on a day-to-day basis through my work.
Wow, thank you, Trina. Deb or Dave?
Yeah, I mean,
Yeah,
I could.
Oh, go ahead.
Sorry. No, I it definitely impacted. I'm involved in legal services and the bar association and judges, and I would be networking a lot with my business, and that really affected me for a long time, because I just didn't, feel comfortable being in public. It's kind of, I don't know, maybe it's just vanity, but I just didn't feel that's myself, my smile. I just couldn't be myself. I did feel that inward feeling, and it wasn't pleasant.
Yeah, so for me, it's interesting you ask about all those doctor's appointments. I have a unique career. I'm an airline pilot, and when I work, I'm gone 3, 4, 5 days at a time. So I can't just leave the office to go to a doctor's appointment. So for me to go to a doctor's appointment, it means calling in sick for a whole trip. I can't just call in for one day of it. So one doctor follow-up or appointment will cost me 3, 4, or 5 days of sick time. So that's a huge burden for doctor's appointments, because I don't have a lot of schedule flexibility, meaning if I have to schedule a dermatology follow-up 3, 4, 5 months out, I can try to get that day off, but it's difficult. So I burn a lot of PTO, and it's a burden on me, and it's a burden on my employer.
Yeah, I'm gonna move on to the next question, and I'm gonna ask you, Dave. And Dave, I know you provided us with a few photos. Is it okay if we share those photos?
Absolutely.
So I'm just curious. I mean, you obviously mentioned you're an airline pilot. Your disease had a pretty significant impact on your work life. I'm also curious, if there was other daily activities that you were unable to perform, maybe as as fully, or at all, just due to your condition.
Oh, absolutely. I mean, you can see during my bad initial flare, which is in the pictures, I mean, just day-to-day functioning was difficult. With the exception of leaving the house for doctor's appointments and treatments, it was difficult to, just take care of myself. I was in those photos in my late 20s. I had to move back in with my parents because I needed full-time care. I couldn't, I just couldn't do pretty much anything on a day-to-day basis. And believe it or not, those photos actually weren't even me at my worst. So, just taking care of myself, I needed help at that time.
Wow. And how about you, Trina? Were there any activities that you were not able to do, like just daily, regular activities that you were not able to do because of your disease?
I think generally just talking to people, because when I had blisters in my mouth, I still have blisters in my mouth, have them now, they're not as bad, but you don't have that confidence to talk to people because you kind of hold back. But also talking hurts, it's painful. So when you go into a group of people that's, you're expected to socialize and to be with people, you then are that one in the corner who aren't talking to people. So it impacts what you're able to do socially. That's how it's been very difficult for me. I'm quite a social person.
Right. And
also,
Deb?
can I just say, sorry,
Oh, yeah.
also catching, because of the severe immune suppression, the fear of catching something, catching an illness, even just this weekend, I go to church, and at church on Sunday, somebody came up to me and they were wearing a mask, and I said, "Oh, why are you wearing a mask?" "Oh, because I've got quite acute tonsillitis." And I sort of ran from them. And I actually went and burst into tears because I thought, I don't want to be here. So yeah, just generally day-to-day fear of infection.
Thank you all for sharing.
Scary, right?
Yeah, and you guys have all kind of touched on it. Dave, you had mentioned moving back in with your parents, and Trina, you're turning inwardly. How did your diseases affect your families?
Can I chime in on that? My husband, thankfully, was and is now for yet a new cycle of disease that I'm going through, under chemo treatment for breast cancer. He's amazing. He for 4 months he treated me. He took care of my food needs. He would cut all my food like a toddler, and make sure that I had soft food to eat. I mean, it's a burden on your family, and thankfully I had that support from him.
I mean, So for me, I could tell you during that, that initial severe flare, when I was with my parents, I had a refractory case. So steroids weren't working. Rituximab was just beginning to be used off label. My parents were pretty sure that I was dying. I mean, they always had a strong face in front of me, but they would leave the room and go cry somewhere because, their son was in such bad shape, and the amount of stress and the burden on them having to pretty much take care of me full time, but then deal with that. I mean, that was beyond difficult. Even now, my wife's amazing. She's a nurse. She's, my caretaker and there for me. But when I have a flare now, I know what to look for. I catch it early, but it definitely puts stress on her because every time I have a flare, we worry, is it going to be as bad as that one? Is the rituximab going to work again? How we're worried about how many times we can go back to that. So it puts a huge amount of stress on my caretakers.
Thank you for sharing. And your families are amazing, and so are you. So thank you for sharing.
And in when I've had serious episodes of pemphigus affecting my airways, in the second COVID lockdown here in the UK, I had such a flare, and my husband had to call an ambulance very, very quickly, and they came within 5 minutes. And his words to the family were, when they took me in the ambulance, he didn't know if he'd see me again. And that caused him extreme anxiety. And sadly, my 17-year-old son has got several anxiety disorders, and one of them being a separation anxiety disorder. And I'm absolutely certain it is because of his fear of their paramedics arriving and taking me to hospital and not knowing what's going to happen next. So it's not just a disease that affects the person with the disease, but those close around them as well. It causes a severe anxiety.
Wow, thank you for sharing that, Trina. Mark?
Trina, I'm just curious, and I know we've got a couple of photos of you as well. Is it okay if we share those photos?
Mm-hmm.
So I wanted to ask you, you've obviously talked a lot about the issues you've had, particularly with your airway and being able to speak. Can you maybe talk a little bit about and maybe describe like how your condition and the symptoms have changed over time? Because obviously you said like, oh, you're back in flare again, or you're having disease activity again. So maybe you can kind of describe how your condition has changed over time for us.
So I first started getting blisters just in my mouth, constant, what I felt was tonsillitis. And then it spread, sorry if you can hear the dog, somebody's just coming in the house. And then it spread to my nose, and the photo that you can see here is pemphigus on my nose, and I kept going backwards and forwards to my doctor, and she was convinced it was just some sort of impetigo. And it just kept getting worse, and actually this is when it was healed, so it was much worse than this. It was kind of spread more down my face, much more oozing and weeping. And then it spread on my tongue, my lips, and really 2020 is when I had my first, I started on azathioprine because of the severeness of it, but then that caused my liver enzymes to go up the creek, so I then went on to mycophenolate. Huge high doses of steroids for such a long time. And then October 2020 is when I had a really, really big flare, and I didn't think I was going to make it. And then my doctor suggested I had rituximab. And up until then, I'd wanted rituximab, but then when it came to having it, I didn't want it because of COVID. So I was really afraid of catching COVID. So since then, 18 months later, the blisters are coming, fast and furious again. And I'm literally going to have rituximab again in the next couple of weeks.
Wow. Quite a journey. Just what you've experienced over this time period. How about you, Deborah? Like, how can you tell us a little bit about how your disease has progressed and what you've experienced over time?
Yes. Thankfully, mine currently is is very low activity level. Of course, when it was at its worst for years, and it was referred to as poorly controlled. But I don't know. And I saw dermatologists. I saw dental. I saw people who doctors, great doctors who have just who were giving me different treatment options that I wasn't comfortable with. I wasn't, because I was on and off methotrexate for years and resisted that. So that's why I went on and off it for my RA, because I'm concerned about my immune system, because I have asthma, lung issues. And when I'm on the methotrexate, I get sick a lot. I end up in the emergency room with my breathing and all that. So I resisted taking any sort of disease modifying drugs for my mouth, because I thought that it was, wasn't, to me, it wasn't life threatening, but it still affected my, being able to eat and such for a long, long while. But I finally, through an endodontist, I got a referral to somebody in Boston. And I have been finding a lot of success with the dexamethasone oral rinse, and of course, there's always some kind of drug in my body, so it stays at a very low level. I mean, I could still stick myself and it'll bleed easily, but I think it's at a place where I'm okay living with it. I can't complain compared to, again, what I'm sharing with my community here, fellow community.
You made some really important points. You said, there's always a drug in my body, right? Like, that's a very interesting perspective to think, oh, there's always, I'm always on something. And then also you mentioned that, you have the short-term, effects of the disease and dealing with the disease, but also just trying to manage the long-term effects of the treatments and the therapies like methotrexate. So it is extremely challenging. And Dave, I know he saw like your photos, obviously. Can you talk a little bit about how your disease, I mean, and I know that, we've talked about flares, but like, Dave, maybe you could talk a little bit about how your disease has progressed over time.
Yeah, I mean, you can see from those photos that I had a severe disease. That was my initial, we'll call flare, when it started. And that took a couple of years to get under control. And I was one of the early patients to receive off-label rituximab with IVIG. And that had its own set of challenges, being new to this disease and insurance coverage, whatnot. I was lucky. It took a few years to heal, but I spent 13 years in remission, which I consider myself very fortunate for. But then in 2018, I had, a flare again. I knew what to look for. I caught it early, went immediately back to rituximab, but I haven't been able to get back into remission again. Every, 8 months or 12 months, it'll pop up again, and, we'll hit it with rituximab again. But so far, it's just kind of, kept disease activity at a very low level. And, fingers crossed I'll be able to get back to remission. But so far, like you said, there's always a drug in my system at this point.
It's interesting. I hear, and we hear this a lot, like, you'll hear us, I hear people saying, oh, I'm lucky, I'm lucky. And so there's the kind of this underlying feeling of hope in our community, that we hope that, treatments will be coming, and we hope that we'll be able to, our diseases will be able to improve so that we can, function on a daily basis. And we also hope that, eventually we can go into remission, if treatments and therapies come along. And it's good to hear, that, those statements that people are lucky and they're fortunate, and it's true, but, there's still a lot of work to be done. And there's still just, a lot of burden on all of you that have these diseases. So I'm going to move to this last question. As just to kind of wrap things up a little bit with you all. And I'm just curious, and maybe I'll start with you, Trina. You know, what things do you worry most about your condition? Like, what's the thing that worries you the most?
The fear that it's never going to go away, that the illness is always going to be there, the fear of every day, every minute not being able to breathe. It's the most awful experience, like a light switch, as I've said already. And the detrimental effect that it has on my family's health. So not just on me, on my family's health. And I feel it's caused the ongoing blisters cause extreme pain. But I feel that while we really do tackle the disease with medicines, with drugs, and as Deborah's already said, there's always a drug in your system. I feel that we cannot underestimate the psychological impact that this disease has on patients and their families. And I do feel that this is something that does need addressing. I know we're looking at medicines to treat this illness, but also we mustn't ignore the psychological impact that these treatments have on us as patients.
I think that's an important point to highlight, is the mental aspect of this disease. And it's almost as strong and as heavy as the physical burden. So Trina, thank you so much for mentioning that.
Yeah, Dave, what worries you the most?
I'll partially echo what Trina said. The fact that there is no cure, that this disease is always going to be there. And even spending a long time in remission, it was always in the back of my mind that it was there and that it could come back. I use the analogy that it was a predator stalking me. At times it was far away, but I could still hear it out there. My biggest fear is that at one point rituximab is going to stop working. That was the only treatment that worked for me. And, I worry that if that stops working, what other treatments are out there that I could use? So that's, so far it still works, but it's always in the back of my head. And that's probably my biggest fear associated with this.
Right. What about you, Deborah? What worries you the most?
I think it's always been that, because I've known you all for so long, that my disease is going to start to migrate to the other parts of the mucus in my body. I'm very aware of that every time something with my eye turns up, or I think something is going on with the nasal passages, but I've been ignoring it. I think that what's not maybe the opposite of what makes me so worried is that I'm so happy that my whole outlook about drugs like this, about treatments like this, serious treatments, is I always was worried about the risks of the side effects more so than anything. But now that, since I do have breast cancer, and that is what's going to save my life here, I'm tolerating it really well. I would go through the treatments that I was always so paranoid about, but I am glad that now that if something does happen, if it does spread, that I know that I won't be as hesitant to use certain drugs that before I just was, no, I won't, I'm refusing. So I think it's that balance of, yes, I'm always worried, it's on my mind, but I know that now I'm not going to be as worried taking years to get it under control.
Yeah. Thank you all for those comments. I'm gonna ask Professor Jolie and Dr. Payne, just you've had the opportunity to hear from this select panel of patients, and I know you hear from you treat patients every day, you hear from patients every day. I just wanted to see if you had any, and I know Pascal, you have your hand raised. Just wanted to see if you had any comments on the disease symptoms and treatments and how they really impact patients' daily lives. Pascal?
Yes, I just wanted to add that in my quite long now experience, I have been very impressed by the fact that in addition to symptoms which are directly related to the disease and the burden, which have been very well described, even patients who are in complete remission, many of them are very anxious about the risk of relapse and the fear of having to take corticosteroids again. And there are many patients who say that I am in remission as with a cancer, and I am not cured. I am only in remission. Whereas I would like to underline that among pemphigus patients who are treated first time with rituximab quite early in the course of their disease, after 7 years of follow-up, between 50 to 60% of patients did not relapse anymore, and these patients are very likely definitely cured. So it's half of the patients that now with rituximab, especially in pemphigus and to a lesser degree in MMP, but especially in pemphigus and especially when the disease is treated quite early, half of the patient will never relapse. And these diseases can be cured. It's true that some patients are only in complete remission and still have a risk of relapse, but this disease can be cured, definitely, especially if they are treated quite early.
Thank you, Professor Joly, for that comment. Dr. Payne, did you have any comments?
Really appreciate all of the anecdotes you shared about how it affects your life, and it definitely echoes what I hear from my patients and a lot of the things that also patients don't feel comfortable talking about. You know, pemphigus and pemphigoid can affect almost all mucosal surfaces at the orifices is what we usually say. So, you know, the eyes, the nose, the mouth, the larynx, where it affects speaking, the esophagus, where you can't swallow, you know, so breathing, speaking, swallowing is all difficult. It can also affect the genital and rectal mucosa. So even bowel movements, urinating, sexual relations can become difficult and affect interpersonal relations. And finally, you know, the amount of time that we also spend working with patients filling out FMLA forms, you know, so that they can get time off of work for doctor's visits, unexpected flares, you know, it really does permeate every aspect of their personal and professional lives.
Yeah, thank you so much for pointing those issues out. So I just want to give a big thank you to Katrina, David, and Deborah for sharing your journey and, you know, sharing how your diseases have affected your daily lives. Thank you, Dr. Joly, again, and Dr. Payne. You know, it's not easy for patients to share some of these intimate details. But, you know, I want to emphasize to you that the FDA and the IPPF really appreciate all of your honesty and candor when it comes to these very, very difficult topics. So thank you all again. And so I'm gonna pass it over to Becky, and we're gonna move into some open comments from some patients next. So and I think she's gonna launch a poll here. So thanks again, everybody, and I'm gonna pass it over to Becky.
Thanks, Mark. And again, thank you to our panelists for being so open and sharing so much of their intimate lives. So before we move into the discussion, to those listening today, we're going to launch another poll. And this is how the disease affects your social life. So as we move into the open comment period, we ask you to limit your comments to those related to your disease symptoms and your treatments and how they impact your daily life. Please say your full name, where you're from, and which disease you have, and then give your comment. So let's start today's first open comment period with Fred Wish from New Jersey.
Hi, my name is Fred Wish. I'm a Pemphigus vulgaris patient.
So Fred, if you could turn on your camera for us.
I'd be happy to. No, says you, the host has stopped.
Oh, there you are.
There I am. Okay. now that I'm on camera, I'm still Fred Wish, and I still have Pemphigus vulgaris. And I'm sorry, Becky, I missed what else you were asking.
Oh, just who your name and your where you're from, and then your comment.
And I live in New Jersey. And I've been a PV patient for nearly 16 years. At this point, I guess I'm in what I call chemical remission. I'm on a maintenance dose of methotrexate, which keeps new lesions to a minimum, be 1 or 2 a month. My doctors and I have tried over the past 5 years to lower or stop the dosage from time to time. Turns out that's a bad idea. I experience significant flares every time, the worst of them lasting 8 months or so. The more aggressive treatments like IVIG, rituximab don't make a lot of sense for my mild case of PV, although I've discussed alternatives with my practitioners from time to time. If I'm careful, the old school regimen I'm on keeps my symptoms under control. I moved to a small town at the Jersey Shore a short time before I was diagnosed. Even though my symptoms are controlled, PV and sunshine still don't mix well. So my beach time is confined to evenings after the sun sinks below the dunes. As a matter of fact, avoiding the sun has become one of my personal superpowers. I'm really good at finding small patches of shade wherever I go. Also resulted in a rather impressive collection of hats, especially wide-brimmed fedoras. One positive way PV has influenced my life is that my wife nearly always comes with me for my monthly trips into Manhattan for follow-up visits and adjustments in my meds. So when our schedule permits, we'll build in a post-appointment Broadway show or museum or jazz club visit. Of course, it hasn't always been this easy. I had symptoms for 7 months before my diagnosis and was in constant pain from raw patches on my back and scalp, especially in my mouth. And I remember my grandchildren noticed me wincing when they hugged me. My provider started me on a high dose of prednisone to gain quick control of my symptoms, and later introduced methotrexate as a steroid-sparing alternative. And for a time, I was entirely off all medication. Remission, as Dr. Jolie pointed out, is kind of a slippery term. What it means to me is being symptom-free without medication. So from January 2013 until June 2016, I was in true remission. And I got a little cocky. I let my guard down a bit. And my hopes that my PV was gone disappeared when I went from 0 lesions to around 70 in the space of 3 or 4 days. Those lesions are about on a level with having touched a hot stove, usually. Manageable, but something I wouldn't wish on anyone. I had one under my fingernail, though, that rated a solid 8 on the pain scale. Interfered with my guitar playing. I'm in several bands and jam groups, as well as interfering with my sleeping. That flare felt like a failure, as well as interfering with my activities. It also affected the way I view relationships. And it was kind of a wake-up call that I needed to reestablish a more vigilant approach. Avoiding sun damage, getting enough sleep, avoiding negative stressors are important in controlling my symptoms. Diet isn't really a factor for me as it seems to be for others. I pretty much eat what I want, although I'll avoid foods that irritate the inside of my mouth when I have active oral lesions. I can still enjoy jalapenos, habaneros, not so much. The risks of COVID are increased for PV patients, so extra precautions and up-to-date vaccinations are crucial. I stay cautious and watchful, but I'm able at this point to maintain the activities I love: music, tinkering with my 40-year-old sports car, helping out in the local homeless community. It's a good life. My symptoms are mild, but I have an appreciation for the struggles that this disease has caused for so many others. PV is part of who I am. It's never out of my thoughts.
Thank you, Fred.
Yeah, thanks, Fred. Thanks for your comments. We really appreciate them. Next up, we have our next speaker, our next commenter is Daphne Smolka, and Daphne is from Florida. So Daphne, if you'd like to turn your camera on and your mic on, and I know you've got some comments for us.
It's telling me unable to start video.
We can fix that, I think.
Okay, oh, asking to start. There we go. Hi, everyone. Thank you so much for this opportunity. My name is Daphne Smolka, and I am a patient with Pemphigus vulgaris. I'm here to talk to you today about my symptoms and treatments. My diagnosis was in February of 2013, so for the last decade, I've been dealing with this on a daily basis. Back in the summer of 2012, I had asked my dentist about the gums around an implant. Food had been always getting stuck. The gums felt irritated and inflamed. He said, more careful brushing, extra cleanings, flossing, but he did make a note in my record. Looking back, there were plenty of other symptoms that I had just dismissed or flat out ignored. Most were subtle. I didn't even recognize they were issues, and nor did I mention them to anyone, including my father, who's an orthopedic surgeon. I'm a doctor's daughter, and unless blood is gushing out or bones are sticking out, you just deal. So my thyroid blood work was wacky since I was pregnant. I took Synthroid. My throat was in constant discomfort. I had trouble swallowing. It was itchy. I was tested for strep, always negative. My upper lip was itchy and discolored. My dermatologist said, get laser therapy. I had a rash on my shin, biopsied 3 times, 3 different results, final conclusion, lichen planus. I noticed weird pimples in and around my ears and nose, and I scheduled a facial. I tried a new esthetician. I bought new products. Nothing helped. I'd been getting weird itchy bumps on my body for at least a year, but I thought it was a new mosquito in town. I was covered with these little craters, and I bought Band-Aids in bulk. Everything itched, hugging hurt, and nobody was connecting the dots. Things were getting progressively worse, and I was very frustrated. Smiling hurt, so did talking. My gums peeled off like a clementine when I brushed, and lettuce would cut through and cause bleeding. So at my next dental cleaning, I think it was January of 2013, my dentist said it's desquamative gingivitis, which makes no sense because you've got good oral hygiene. So he said, let's do a biopsy to rule out some 1 in a million possibilities. And the oral surgeon who had done the implant was not available, and I wasn't willing to wait. So I went to his partner who did the biopsy, and the tissue was so fragile that it kept disintegrating, and they kept trying to slice even further down and cutting deeper into the most of my lower gums. The initial results were deemed inconclusive, and they scheduled me for a second biopsy. Then when I went, there was an addendum. I didn't have to go through the procedure after all, which I was very grateful for. I had pemphigoid. Friends and family were consulted, favors were asked, and there was a 3-month wait to see the top doc. So I was impatient, and I went to the next guy. And little did I understand, I was delaying my own proper diagnosis. The first doctor told me I had to immediately discontinue using Zyrtec, which I had been on for over 10 years. Apparently in the fine print that no one reads, pemphigoid is a rare but potential side effect. In the meantime, the other expert said I had to start on Dapsone and Xantex, and immediately I became severely anemic. Over the summer, my family had been on a vacation in Europe, and we had to cut it short. I was not able to even carry my own pocketbook. Most days I was too weak and nauseous to get out of bed, and upon arriving home, customs asked if I needed a paramedic. I went on a medication vacation and I sought additional options. The blood work and skin biopsy were contradictory and deemed inconclusive. It was time for that second oral biopsy, but this time I went to a dermapathologist. And in May of 2014, I finally had a correct diagnosis of Pemphigus vulgaris. But there are a few treatment options, and I was too scared to participate in a trial because I had just spent over a year trying to figure out what was going on. So I immediately started the daily high dose of prednisone, 60 milligrams, and 3 grams of mycophenolate. Following a typical weaning pattern, I slowly reduced the steroid dosage every 4 weeks. To translate that into something very tangible, to mitigate the effects of the steroids, I took a handful of other pills. I take at times up to 20 pills a day, every day. I have a spreadsheet just to keep track of all the information. So to lighten the mood while facing this mound every day, I would make pill art and shape them into flowers and butterflies. But every time I adjusted my dosage, I would erupt in blisters. I felt sick beyond description from adrenal fatigue. The steroids have such an unpredictable effect on the user. I never know if I'm experiencing a symptom or a side effect. Side effects include uncontrollable outburst, often inappropriate, having an insatiable appetite, moon face, muscle weakness, joint pain. I experienced all of those and then more. By January of 2019, I was still symptomatic, and rituximab was now approved by the FDA. So I had 2 infusions following the autoimmune approved protocol, and I did a repeat in July. After rituximab, I chose to social distance and wear a mask in certain situations. It was pre-COVID, so I got a lot of looks, a little ridicule, and my kids pretended not to know me. My pseudo remission lasted an average of 18 months. I say pseudo because I did not stop taking the mycophenolate, and I was still on a lot of other medications. But since it was COVID, I was waiting to see what the data and science would show. I did use that time during the pandemic to finally stop taking prednisone completely. Altogether, I was on steroids for 8 years. It took me 8 months to go from 5 milligrams a day to go to 0. I have to have a very, very slow wean. Long-term challenges exist from taking steroids for that long, even though I'm off it now. I do have cataracts. I do have bone issues. I am currently disease active, and although it's deemed mild, I'm scheduled for another round of Rituxan in February. I hope today's takeaway is to realize the powerful impact the options of treatments will be for patients, and how necessary it is for us to have ideas and hope. So thank you.
Thank you,
Thank
Daphne.
you.
Go ahead.
Go
Beth.
ahead, Mark. No, I'm sorry. Go ahead.
No, it's your turn.
So Daphne, real quick, you had really pointed out quite a few things, from the impact on your family to the need for spreadsheets and the need for additional medication from taking the medications to treat your disease. Would you mind just sharing about how many pills you were taking a day between the treatment itself and then dealing with the side effects as well?
Honestly, it became a job. So once a month I sit and I do pill boxes and I lay them out, because every day to start opening all those things. And I've actually kept all those pill boxes because I'm going to do an art project with them, because it's overwhelming. I spend thousands on medicine. I mean, let's talk about the numbers, but I also try not to take those pills in front of my kids because I think it's a lot for them to see, all those pills. But yeah, there was about 20 a day for when I was on my high doses of prednisone, because, you know, I had like a 20 milligram prednisone pill, but that's still, you know, to take 60, that's 3 pills. And then as you wean, and it gets kind of ugly. I also am very reluctant to take on any new medication for anything going on in my life, just because of the fear I have of the interactions between all the medications and all the pills. So, and I cannot take it in one swallow. I know people who can. It's 1 pill at a time. So I have like a whole morning routine based around getting those pills down and started.
A full-time job, just taking the pills.
Just keeping track of are all of the scripts current, and when do I renew them? And then, you know, like if I take a vacation, I have to like appeal and apply to get a vacation allowance from them, because, you know, I travel a lot internationally, as you guys know. And I need to take a month's supply extra, and that's not always easy to do. And there was one time when I weaned and I would have adrenal collapse, I would have whole days that I don't have any memory of. And one of those days I picked up my medicines. And when I came back home, I went to bed. And that medicine was never found. So I had an entire month of medicine that got lost somewhere in my psychotic weaning experience. And then I had to pay out of pocket because I needed the meds. I had no choice. So that was quite the experience.
Great. Well,
Yeah.
thank you.
Thank you guys for this opportunity. It's really exciting to be here.
Thank you, Daphne. Now we're going to hear from Mei-Ling Moore from California.
And Mei-Ling, you can go ahead and turn your camera on and your mic.
Am I? Ooh.
You're on.
How do I get rid of? Oh, well, I hope you don't mind my background.
No, it's beautiful.
Okay. All right. So I'm Mei-Ling, and I was diagnosed at the age of 54 in February of 2012 with Pemphigus vulgaris, a rare autoimmune skin blistering disease. And this was after 4 months of being misdiagnosed by a highly esteemed dermatologist in Beverly Hills. So what started out as a tiny pinpoint, like an insect bite, quickly spread to large burn-like lesions that covered my entire upper back and was so painful I was scared to death. At that time, there were only 2 dermatologists in Los Angeles who knew about pemphigus. One was Dr. Victor Newcomer, clinical professor of dermatology at UCLA. My doctor got me in to see Dr. Newcomer immediately. Dr. Newcomer knew right away what I was afflicted with. Sadly, he passed away 2 months later. Before he passed, he prescribed 100 milligrams of prednisone for treatment, and my original doctor kept refilling my prescription while I went on a search for a doctor who could treat me. The lesions on my upper back caused me to cut off 7 inches of my hair, making it as short as a boy's haircut. As an Asian, I have coarse hair, and a single strand felt like a razor blade cutting into my skin. I also had to cut off all clothing labels in my shirts, as the pain of touching my skin was excruciating, and it would take me over 10 minutes to lie down on the bed because the pain of the contact of my skin against the sheets was horrible. I had to take bird baths, washcloth only, as the water pressure from the shower was a killer. And one day I was walking on a sidewalk and I noticed some yellow stuff all over my clothing. And I looked up at the sky and I thought, well, maybe birds were pooping on me. And it's not a joke. It's absolutely. So I touched my scalp and my fingers brought clumps of what looked like polenta. It was the pemphigus being active on my scalp. I was horrified. I then could only wash my hair using warm pots of warm water to pour over my head, and I had to wear cotton gloves to sleep in case I scratched my skin or scalp while asleep. And then my gums started peeling back, and I saw that they had blisters, and I panicked. I thought I was going to lose all my teeth. I freaked out. Next was blistering in the insides of my cheeks and on the tip of my tongue, which was the worst because that is the first point of contact when you're eating. Blisters showed up in my larynx and I couldn't swallow. For about 3 months, I could only drink Ensure. No regular food for me. My voice would sound raspy whenever the blistering was active, and I often had to refrain from talking. My new dermatologist, who I found through the IPPF, kept me at 100 milligrams of the prednisone and gradually tapered me down to 5, but that took 8 years, and then another 2 to get from 5 to 0 because I would always flare up again at 4. During the 10 years of dealing with this disease, my dermatologist never once prescribed another medication for me because there was none that was an approved program for pemphigus. And by the time I reached remission, it would take another 6 years for Rituxan to be approved by the FDA. Taking prednisone for 10 years has taken its toll on my body. I developed cataracts, and worse, my bone health started to deteriorate. In May of last year, I fractured my left wrist, and it still has not completely healed. The orthopedic surgeon at UCLA said that having been on the steroids for all those years, the damage was done. I still need to brace to anything. I have had 2 compression fractures in my spine, and they occurred during a bout of coughing. CT scans have shown that my bones are very thin and vulnerable to fracturing. And by the way, I also have to use a cane to walk, which I've had to use for 10 years. I never needed one before. Aside from the physical pain I had to endure, the emotional stress caused by this disease really took a toll on my mental health. Stress is a huge factor in aggravating any condition, any physical challenge, ulcers, high blood pressure, heart attacks. Stress caused not only emotional problems for me, but also brought on more blistering activity. I also kept myself avoiding social engagements as I couldn't risk being bumped into nor catching a virus from anyone with a cold, as my immune system was compromised, still is. Depression affects patients who feel that there is no hope if not enough options for treatment are available, and they must endure months of step therapy until a clinical drug has proven successful. And this can take years for approval and production and availability. The current treatments can, but not with side effects and, in rare cases, fatality. Clinical trials need to consider the long-term use of corticosteroid dosing and more targeted therapies. Options to achieve remission.
Thank you, Mei Ling, for your comments. I really appreciate that, and really illustrates the effects that corticosteroids have in firsthand. So thank you so much. Next up is I'm going to ask Gina Anzaldo from Oregon to join us. And Gina, I saw you were on camera there a second ago. You can please join the camera and unmute yourself.
Camera, no camera, mute, unmute. Can you hear me?
Yes, I can hear you.
Okay. Hi there. Thank you for having me today. These stories, I really feel for everybody who's struggling with this disease. My experience is a little different, I think, than some of the folks we've heard, and perhaps it's because I was diagnosed more recently than them. So I live in Portland, Oregon, and I have Pemphigus vulgaris, and I was diagnosed in 2017. And in Portland, Oregon, we have OHSU, Oregon Health and Sciences University. It's a teaching hospital, and that's just where my normal doctor is. And I went up there, and they sent me to ear, nose, and throat. And a resident looked at my mouth and said, and took a biopsy for pemphigus, and it came back positive very quickly. So I would say I was diagnosed within a week of just my mouth exploding in blisters. It was like, is this a canker sore? Is that a canker sore? What is all this? And then pretty soon my mouth was just completely raw, and I couldn't swallow or eat. It came on very fast, but it was just in my mouth. So when I was diagnosed, they whisked me literally across the way to the dermatology department, where the third phase trial was going on for rituximab, efficacy of rituximab over CellCept. And I qualified because my mouth was in bad enough shape. And I guess my nose, which I wasn't aware, they were saying, is your nose bleeding? I'm like, all the time. Does that have something to do with it? So they put me in the study right away, and it was double blind, so I didn't know what I was on. And turns out I was on Cellcept and not Rituxan. But times were great. The doctors were great. My doctor, Dr. Morrison, all through the trials, you just get just that Cadillac treatment. I mean, multiple doctors searching over your skin. And I thought, oh, this is how everybody gets treated for pemphigus, I guess, which isn't the case. Once the study's over, you're just a patient like everyone else. But so in derm, I had a really good experience there for the 1.5 years that I was in the study. And during that time, rituximab did get greenlit for use. Let me complete the study. I wanted to complete the study, even though I could have stopped a few months early to just go on rituximab. But I said, we're almost here. Let's just finish this so you can have the numbers. So we did that, and then they put me on rituximab. Life was great, and it really was, like I said, it was just in my mouth, and it resolved very quickly. Even when I was on the Cellcept, it was like Cellcept and prednisone, but when I was on Rituxan, it was completely gone. And during that time, I started going to the IPPF conferences, and I did not have the experiences that people at the conference were talking about with taking so long to get diagnosed, or having it on their skin, or come back in different ways, or having a hard time finding treatment or paying for treatment. It was a really fine experience for me, and I went very quickly into remission. And I wish that was the end of the story. So in 2019, in 2019, I lost my voice, couldn't figure out why, went to the throat doctor who said maybe I had some sort of an infection. They didn't know that it was pemphigus. Now I know that's what it was, because it happened. And then it happened again 6 months later. I just woke up without a voice, and I didn't have a voice for a week. Kind of weird, but I didn't put 2 and 2 together. Eventually we did. But where I really understood the stress that people were feeling about being misdiagnosed or not being heard, or feeling alone in this, was in 2020, I actually started getting rectal mucosis, which was called maybe I have a fissure, maybe I need more fiber in my diet, right? And it got to the point, it was so painful, I'm pretty sure it was completely involved, because I could not go to the bathroom. Every time I thought I might eat a little scrambled eggs, I thought, boy, I'm going to pay for this. I really shouldn't eat anything. I mean, and there's just no way to live. And in the back of my mind, I remembered at the conference, someone had mentioned fissures several years back. And so I asked them, finally, this was like after a month of just being on fissure medication and them saying, fiber, 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 don't sit on the toilet too long, all these things. And I asked them to test me for pemphigus. As painful as that was, I said, please, can you knock me out first and then test me? And they're like, no, you gotta be awake. So they did the biopsy, and it came back positive. And I was both very relieved, but now I was very shocked, because it's in a completely different location. And the pain was like, if this is what it is, it was just really unbearable. I was able to get right back on Rituxan, and because other than that, I had no other flare going on, right? So I'd be able to get right back on Rituxan. But even during my infusions, I had to do it in a bed because I couldn't sit. They had to have me lay down. I mean, my backside was such a mess. But now I'm back in remission again, and happy about that. But I feel like whenever I stepped out of the derm department, nobody knew what I was talking about. This is not a colorectal thing that they're very familiar with, nor is a larynx thing. So I don't know. I get really nervous. But now I know when to treat myself like a zebra. My friend said, treat yourself like a zebra and you might get to your solutions faster. So that's just been my experience.
Thanks, Gina. Your story brought up so many things that I think many in our community can relate to. So thank you for openly sharing and being so candid with your story. Our next speaker, Arlene Woke, is from Pennsylvania, couldn't be here today, but she did send an audio recording for us to play for you because she thinks it's important that you hear the story.
I'm speaking on behalf of the IPPF. I am the daughter of a pemphigus patient. My father was diagnosed with pemphigus when I was 13 years old. It took 1 year for him to receive a correct diagnosis, having sought help from 2 or 3 doctors in the small town where we lived. My father fortunately found a specialist in the greater Pittsburgh area who correctly diagnosed him, immediately put him in the hospital. My father was given large doses of cortisone and remained there for at least several days. Unfortunately, cortisone has negative side effects. One of them was that my father developed a cataract, which had to be removed, I think, about a year later. At that time, cataract surgery was more major and required, I think, a 2-night overnight stay in the hospital and many restrictions for at least several weeks. About a year later, my father developed pneumonia. He was very ill. I remember he looked white. He was quite weak. He was hospitalized. About a week or 2 later, he was sent home. About a week or 2 later, he developed pleurisy. And I remember staying up for several hours at night with him because he couldn't breathe and he was really sick. He had to return to the hospital. Since I was in school, I walked after school to the hospital, visited my dad, then walked to my father's store to help my mother, who was running the store in my dad's absence. I helped her. We closed the store, took a bus home, ate dinner. Then when my brother returned from work, in the evening we went back to the hospital. My father had a men's clothing store for many years. It was a small family business. So my mother had to run it when my father was ill. It was a very tough time, that 6 weeks period. And then when my father did return to work, he was weak. And he gradually was able to return to his strength. My father was a strong, courageous man. Several years later, unfortunately, my mother developed cancer. I took care of her. She passed away. So again, I was concerned about my dad. I was his caregiver from time to time. I drove him to doctor's appointments sometimes. My father's specialist was about a 45-minute drive away from where we lived. But my dad persevered. I knew there were times when he didn't feel well, but he didn't complain. My father lived 27 more years to the age of 77. I want to emphasize strongly that pemphigus does not only affect the patient, as it certainly did for my father. It also affects his spouse and his children and his ability to work at times. As my father's youngest child, who was close to my dad, it was especially difficult for me. So I ask you to please fund treatments and research for pemphigus and other rare diseases. It will make a major difference in people's lives. Thank you very much.
We want to thank Arlene for sharing that story about her and her father and how she had to care for him, during those very difficult years. Next up, we have Brian Scott. And Brian, if you can unmute yourself and turn your camera on and provide your comment.
Okay, my camera is showing on here, so I'm not seeing it on the screen. There we go.
There we go.
All
Now we
right.
can-
Thank you. My name's Brian Scott. I live in the Charlotte area of North Carolina. I am a Pemphigus vulgaris patient, have had a couple other Pemphigus mutations as well. I want to thank you for the time and the opportunity to speak to you today. A little bit of my diagnosis journey. I spent about 5 years playing tag with the dentist. I would get lesions in my mouth. By the time I could get a dentist appointment to go in to see the dentist, there wasn't anything in my mouth. So that went on back and forth for about 5 years. Then I started getting a sore spot up here on my head that was just red, wouldn't do anything with it. My doctor wasn't concerned about it, but then when I started getting some other lesions on my arm and chest, he got me into a dermatologist. First visit with the dermatologist took about 5 minutes. Her comment was, well, you just got SK, Scariolkeratosis, I think is how it was pronounced. And she said, take these antibiotics, come back in 30 days. 30 days later, I'm sitting on the table in the patient's room. The doctor sticks her head in the room and she goes, oh shit, I got that one wrong. Just yelled it out loud as could be. And then she said, hollered back to her nurse, said, we're going to be here in a while. 45 minutes later, she asked to do a biopsy. She did a biopsy, gave me a post-it note with 4 possible diseases. I didn't do anything but go home and consult Dr. Google and put each one of the names in, and lo and behold, Pemphigus vulgaris met all my symptoms. I got a confirmation a few days later back from the dermatologist, and we started me on my treatment process, which was 100 milligrams of prednisone and oral prednisone rinse and tropical creams. And the pharmacist wouldn't fill it because he said that's too much prednisone. So we had to go back and forth and fight on that. We got that taken care of. And they also put me on resomyoprine. And 3 weeks later, I had an allergic reaction to the drug and ended me up in the hospital. While this is all going on, the drug is the Pemphigus is peaking on me, and my mouth became one big open sore. Putting baby lettuce in my mouth was like putting shard glass in my mouth. Drinking anything was like drinking through electrical wires. I ended up losing 60 pounds in 5 weeks. So that's not a diet I recommend for anybody, but that was what I came up with. So after I get out of the hospital, when they were treating me for both dehydration and trying to get some weight back on me, as well as they thought I had an infection in my bloodstream, which thankfully came back negative, my doctor weaned me down to 40 milligrams of prednisone and switched me over to 200 milligrams of Dapsone. And I was on that for 12 months. Fortunately, I haven't had any side effects from that. The doctor left her practice, so I switched to one of the doctors up in Wake Forest. And he kept me on prednisone and put me on Cellcept. And we spent about 12 to 14 months of trying to get me off of prednisone. I could get down to somewhere between 10 to 15 milligrams, go on that for 2 to 3 weeks, and I get another flare up. So that process kept up for a period of 12 to 14 months. And I was in Atlanta doing some work, and all of a sudden I woke up one morning and my mouth was raw like it was before. So I called the doctor back. I said, we got to do something different. He said, that's the only medicine I'll prescribe. So I switched universities and went to a different university and got in to see a doctor there. We started the process with me with Rituxim. I took the first round of Rituxim. I lasted about 6 months. Had to do another dose. That dosage allowed me to get about 12 months of freedom. Then did another dose and got 18 months. And when I went back 16 months ago to get the last dose, the insurance company said, we're not going to fund Rituxim. You got to take a biosimilar drug. And when I started doing the research, the biosimilar drug was not approved for off-label use. It did not have any biologicals. And if the drug failed, I had to wait 6 months. And I basically told them that was not an option. My day job is I'm an ADA coordinator. I threatened a lawsuit under the Americans with Disability Act. And 2 days later, they approved me to take Rituxim again. But I shouldn't have had to go to that point to threaten the insurance company to do the work. Side effects over all of this, I count myself as being lucky. The two major side effects that I have developed over the period of time is I do get migraines now. I never had migraines before, but I can get nasty migraines now. And then there are certain foods I can't touch. I can't eat. When I started eating back again, it was like a baby. I had to take food and eat it for 2 or 3 days to see if I was going to have a reaction in my mouth. I put uncooked broccoli in my mouth blows up like a jellyfish. I get blisters in there. But so far I've been, that's been my side effects of it. Again, I count myself lucky. I'm 16 months into chemical remission. I'm starting to get some blisters in my mouth again. I'm afraid I'm going to have to do another round of Rituxan soon, but at least like Dave said, I hope it keeps holding out and holding on for me. I thank you for your time.
Thank you, Brian. Thank you for sharing your story. So many relatable points in your story. Now we're going to hear from Ellen Levine from Massachusetts. Ellen? Ellen, I'm going to ask you to turn your camera on.
I'm here.
There you are.
Hi, good afternoon. My name is Ellen Levine. I'm from Boston, Massachusetts, and I've been living with Pemphigus vulgaris for 16 years. By 2006, I had taught English in China. I had worked for a global engineering company in San Francisco, and I had just moved to Australia to start a new adventure. I had prided myself on my adaptability and readiness to take on new challenges, but these attributes did not prepare me for what was to come. So at age 45, I looked and felt remarkably healthy, but when painful lesions and erosions started to appear on my gums and inside my mouth, peeling off like sheets of tissue paper or like layers of onion skins, and I began to lose weight quickly, about 10 pounds over 2 months. I panicked because as much as I didn't want to trust my instincts, I knew something was terribly wrong. So from Australia, I returned to the States in search of a diagnosis where I saw 14 specialists. I was given some misdiagnoses and inappropriate treatments before I finally found the physician who would treat me. And when my biopsy confirmed pemphigus, little did I know how radically my life would change. Pempho what? This new word, like the disease, was going to become part of my everyday life. Well, the pemphigus progressed quickly from my mouth to almost every part of my body. My esophagus, my ears, my nostrils, chest, torso, back, belly button, legs, and my areas below the belt. And the areas on my scalp that one dermatologist had told me were eczema, they started to peel off like glue, along with much of my hair. I was incredibly frightened, and I felt my body was betraying me. The first few years of my treatment are what I called my quote unquote trial and error pill popping phase, trying to determine the most effective medication along with the appropriate dosages while minimizing the adverse side effects. I have tried the majority of systemic meds that are used to treat pemphigus, including mega doses of prednisone, a steroid, dapsone, an antibacterial drug used to treat leprosy, sulfasalazine, an anti-rheumatic drug used to treat RA and other autoimmune diseases, methotrexate, a chemotherapy agent which is used to treat different types of cancers and some autoimmune diseases, Cellcept, an immunosuppressant and organ anti-rejection drug, Kenalog injections, which are steroid shots that were made directly into my non-healing and recalcitrant lesions on my skin and scalp, several different antibiotics for wound infections, and a variety of topical treatments for my mouth and skin. I've had about 150 infusions of intravenous immunoglobulin and rituximab, a monoclonal antibody which targets and destroys the B-cell lymphocytes, and that necessitated my having to get a portacath implant. And in desperation for a cure, I tried a number of off-label approaches to treat my lesions, including hyperbaric oxygen therapy, which is a high-pressure oxygen used to treat chronic non-healing wounds, typically from diabetes and radiation therapy. Now, hyperbaric oxygen therapy is not used to treat pemphigus, but I was desperate and willing to pay out of pocket and a lot of my time for this very unorthodox and experimental treatment. So I spent 2 hours a day, 5 days a week for 6 weeks, lying in an oxygen chamber, breathing 100% oxygen to see if my lesions would clear up. Oftentimes, the accompanying side effects of these meds were worse than the lesions and blisters that covered my body. I experienced elevated liver function tests that were off the chart, lower than normal hematocrit levels that impacted my energy level, jaundice, neuropathy, fluid buildup, infections, wound abscesses, to name a few. And during the first year of my diagnosis, I had over 80 doctor's appointments. So managing this disease was a full-time job, and I was unable to work as a result of that, as well as due to my physical condition. I also experienced that notable moon face look at times, and I felt like I was experiencing steroid-induced psychosis from the extremely high dosages of prednisone I was on. So my physical appearance, as well as my mental state, had changed vastly from when I was in Australia. I had never used systemic medication regularly, and I came to respect the power of Western medicine. I learned the power of these meds was not to be taken lightly. I adjusted my diet since certain foods triggered oral lesions. I altered the way I bathed since the blisters on my body and scalp, comparable to second-degree burns, could not withstand water pressure. I wore wigs and scarves for years to cover the blisters and hair loss on my scalp. And I learned a lot about wound treatment over the years. My pemphigus journey has been a long one and still ongoing, although I'm in pretty good shape now. And I tell my story here with the hope that other patients who are newly diagnosed, as well as future patients who have yet to learn the word pemphigus, have a much shorter and less traumatic journey than mine. Thank you for listening.
Thanks, Ellen, for your comment. And I think it really illustrates, like you said, that trial and error that patients experience with this disease. So thank you so much for sharing. Our next comment is from Marnie White, and Marnie is joining us from Connecticut. Welcome, Marnie.
Hi, thank you, everyone. I also want to thank everyone who's spoken today. It's been an incredibly validating experience to hear so many other patient stories that are similar to mine. So my name is Marnie. I was diagnosed with Pemphigus vulgaris in December 2019. In terms of symptoms, it was caught in the mild phase, but quickly progressed to moderate by the time I could initiate treatment. I saw 6 different physicians, 4 different incorrect diagnoses, including a provisional cancer diagnosis and multiple painful biopsies and procedures to get the diagnosis itself. These were, of course, painful and quite scary, somewhat of a roller coaster in terms of the emotions for that period. Like everyone else who's spoken, I experienced pain, sleep difficulties, difficulty eating. This was manageable, at least at that point. I was able to start Rituxan within several weeks of diagnosis and achieved remission after just 2 rounds. In my case, the more significant impact was with respect to the treatment itself. My first round of Rituxan was in February 2020. My immediate side effects were uncomfortable, but also manageable. I experienced fatigue and nausea. This required that I take off a few days from work following each infusion. I'm a professor, and for a few classes, I had to sit down in the middle of lecture due to dizziness and exhaustion. This fatigue and nausea were intermittent but prolonged, lasting several weeks to months. But I was able to continue working through this time. I was, however, a lot less productive. Because of the fatigue and the time commitment of the treatments themselves, I backed out of several job commitments and opportunities, including canceling a book contract, opting to delay my own promotion because I was too fatigued to go through the process. And so these factors combined with the out-of-pocket costs of treatment had a very significant financial implications. The larger impact, however, the largest was really with respect to the immunosuppression in the context of the emerging pandemic. Because I was teaching about what we called then the novel coronavirus in the epidemiology course that I teach at Yale, I realized that I was high risk to COVID, and this was confirmed by my team of physicians. And this is where the impact on daily life really comes in. Because I live in a suburb of New York City, COVID cases were already documented in this region. So after conferring with my physicians, we pulled my child from school before the lockdown. We thought this would be a precaution for perhaps a few weeks. Ultimately, my family and I remained isolated in our home for 706 days from March 2020 to February 2022, because I remained maximally B-cell depleted and I could not generate antibodies to the COVID vaccine. My physician determined that if I were to be exposed to COVID at that degree of B-cell depletion, it could be fatal. Unfortunately, I am still an outlier. Even though I am now 32 months out from my last round of Rituxan, my B cells have not yet repleted. But after my fifth COVID vaccination, I was finally able to develop antibodies. This was approximately 18 months after my last round of Rituxan. My physician approved travel by car. And so at that time, I was able to visit my mother who lived in another state. I had not been able to visit her for the entire 2 years that we remained isolated. And I'm very grateful that my risk level improved at that point in time to allow leaving our home, because she died a few weeks after that visit. I'm sorry, she was dying throughout that entire period. It's recent. After or around her death, I did have another flare of pemphigus. And because I was still in the midst of such a lengthy period of B-cell depletion, and because the pandemic is ongoing, we opted instead to initiate IVIG. Unfortunately, I was not able to tolerate that, ended up in the emergency room owing to extreme side effects that I experienced at that time. So I would say in terms of the impact on daily activities, the primary complication is with respect to the ongoing pandemic and the dangers associated with being immunocompromised in the context of a novel virus. My 10-year-old child was unable to attend school for an entire year because Connecticut provided no remote school alternative. My husband's work also requires face-to-face interactions, so he was unable to work for the duration of our isolated period, and his was the primary income. Fortunately, I was able to keep working from home because I have the privilege of working alongside physicians and public health experts who understood the seriousness of being immunocompromised during this time. The university was also quick to accommodate, but I had to convert all of my courses to distance learning classes and had to switch all of my private practice patients to telehealth. If I worked in another field or were more involved in direct patient care, I would have had to take a leave of absence. And that was my story. Thank you.
Oh, Marnie, that was really emotional, and thank you for sharing with us. We're going to hear from Stacy White now from New Jersey, and Stacy was kind enough to send pictures, and so I think we're going to share some of your photos while you talk.
Good afternoon. My name is Stacy White, and I have Pemphigus vulgaris. Excuse me, got it. If you just one moment, I just want to thank all those who spoke before me, and certainly in particular, Marnie. I know speaking is not easy and telling the story is not easy. So I just applaud you for your courage, particularly as it connects to your mother. So thank you for showing up for our community today. In the late winter of 2010, I scheduled an appointment with my gynecologist after noticing lesions in my vaginal area. She tested me for an STD twice over a period of a couple of weeks, with the test returning negative. By the spring of 2011, crusting blisters began to appear on my chest and face. The scabs would fall off, but then the process would begin again. The blisters did not heal, but regenerated in the same spots while slowly spreading across my body. As this occurred, my primary care physician and dermatologist put me through a battery of blood and urine tests, which yielded no answers. The blisters continued to ravage my body, causing me to have to wrap it in gauze and hold that gauze in place with a tank top each day just to get dressed to go to work. As the blisters began to occupy more real estate on my body, my energy quickly depleted and the pain rapidly ensued. About a week before Memorial Day, the dermatologist told me that I had shingles and started me on a course of treatment. Within a week of that diagnosis, blisters covered 85% of my body and began to cluster and connect to one another, forming large, fragile landscapes. The Friday before Memorial Day, the dermatologist called me to tell me that I did not have shingles, but probably had some type of autoimmune disorder and should schedule an appointment with someone at NYU. I called, but no one was available. I fell quickly into a depth of sadness and despair I have not known since that moment. The next day, I called my friend Renee and told her, I cannot take this another day. I do not know what to do. When she and our friend Cindy arrived at my home, I was so sick that my walk was more like a slow shuffle. My feet were barely able to leave the ground, and I could not stand erect. My diva nature was still intact, though, and I was determined to leave my home feeling like my life was normal, even as it was falling apart. I grabbed a black baseball hat to cover my undone hair and put on my cutest pair of slippers. My friends then drove me to Hackensack University Medical Center. Hackensack University Medical Center's ER, a brief trip from my home. Shortly after arriving in the ER, the attending told me she thought she knew what I had because she had seen it in medical school in a textbook. The clinical team called specialists back from their long weekends, an immunologist, a dermatologist, an infectious disease specialist. Fearful that I may not leave the hospital, I showed my friends and family where the important numbers were on my phone. After that, I remember little from the ER. I spent 8 days in the hospital over the course of 2 stays, during which I received 3 biopsies, was given fluids intravenously, and was treated with antibiotics, Dilaudid, high doses of prednisone, as well as other medications. The extent of damage to my skin was so severe that it required me to receive the same level of wound care as a burn victim. Upon discharge, my treatment regimen included mycophenolate, prednisone, vitamins, along with the laser focus on overall wellness. It was a hard-fought journey to remission over the next 5 years. Along the way, I had a significant flare the first time I was tapered from prednisone, This would require me to start my treatment regimen from the beginning. I was fortunate to have, during this period, the support of a village of family and friends. Almost 12 years after diagnosis and 6 years in remission, I worked for the hospital in which I was diagnosed and made the decision to volunteer on COVID units at the height of the pandemic, to the dismay of everyone in my life. But this was something I felt I had to do to pay forward the care that was given to me when I was there. The scars on my back, stomach, arms, and legs still bear witness to Pemphigus vulgaris's path on my body and remind me that I am a warrior, especially on the days that I don't feel like one. 2 years ago, I changed to a vegan lifestyle as a way to continue to keep Pemphigus vulgaris at bay. I am a board member for IPPF, which creates space for me to advocate for patients like me in forums like this. And I live with the freedom derived from gratitude for where I am on this journey, while also feeling like my toes are on the edge of a cliff most days. Because I know remission is not a cure, and I fully understand that Pemphigus vulgaris is a chronic and unpredictable condition and therefore my journey is far from over. Thank you.
Thank you, Stacy, for those very emotional words and comments. Next up, we have Ingrid Thompson from the UK. And Ingrid, you have some pictures that you said we could share. Is that okay if we share them now?
Yeah, that's fine. They're not brilliant quality, but I think they sort of show how ill I was.
Real life. We want to see the real life stuff. So thank you. So tell us your story.
Okay, so my name is Ingrid and I live in Leicester, which is in the middle of England in the UK. In April of 2015, when I was 55, I was diagnosed with bullous pemphigoid. I had blisters all over my body when I was hospitalised on April the 8th. 55 is comparatively young for bullous pemphigoid, as it's usually considered to be a disease of older people. The previous year had been extremely stressful, and although there's no proof, my friends, family, and myself believe that stress played a big part in me developing BP. Toward the end of 2014, I developed an itchy red rash, patchy rash. It started to spread, so I went to my doctor. I was given some gentle steroid cream, but the rash spread and got itchier, and various things were suggested for its cause, like eczema, contact dermatitis, and scabies. Scabies is actually quite a common misdiagnosis of bullous pemphigoid rash. Many family doctors know little or nothing about this disease, let alone having seen someone with it. At the end of March 2015, I flew to the island of Madeira for a week's holiday. I still had the bad itchy rash, and here I do emphasize one, that's the bottom right-hand picture, blister appeared on the day we flew out. Hindsight's a wonderful thing. And if I'd known what was going to happen, I wouldn't have gone on holiday. But most of these bulli appeared whilst I was in Madeira, leading to one of the worst weeks of my life. Within the space of a week, I'd gone from one blister to being covered from head to toe in them. The itch was appalling and I couldn't sleep. Having something so drastic happening and not knowing what it is one of the worst feelings in the world. Indeed, feeling alone is one of the worst factors in having a rare autoimmune blistering disease. And finding people with the same thing is such a relief and comfort. Hence, I think, the need for patient support groups. The flight home was horrendous, people staring, etc. And I waited 3 days for the doctor, as it was Easter Saturday, the 4th, when we flew back. On Tuesday, the 7th of April, you can see the state of the blisters on my arms and legs. I got an appointment with my doctor. He took one look at my skin and realised I needed help quickly. He got me an emergency walk-in appointment for dressings to be applied. And I still remember the look of shock on the face of the nurse who came into the room to dress my blisters. Next day at the hospital, the clinician who saw me was nice. And I actually found out she's one of the top experts in the field of blistering diseases. She asked the poor student who was with her to count my blisters. I had, wait for it, 467 of them. I was immediately admitted to hospital, which was a relief, to be honest, as I had found out that bullous pemphigoid can be fatal. I was put on a wheelbarrow full of drugs, including steroids, which help the blisters to disappear quickly, but have side effects. I was given steroid creams, but the pharmacist at the hospital did not realise the extent of my blisters and thought that one 20-milligram tube was enough to cover all my body. My blood pressure had to be taken on my ankle, as that was the only area without blisters available. And the nurses had to aspirate the blisters, meaning I needed a change of sheets every few hours. My diagnosis was bullous pemphigoid with gingival intervention. My gums and mouth are also affected with inflammation and blisters. I knew I wasn't infectious, but people stared and some even asked. It's very hard to deal with, and I wasn't always polite in my response. In the end, I spent nearly 3 weeks in hospital in 2015, and my whole life had changed. Medications, side effects, constant tiredness, retirement from my job, as I had a public facing job. The list is endless. And the itch is so hard to deal with. But I found cool pads helped. And once home, I lay on sheets on my sofa, which I got especially, as the cream and weeping blisters meant that wearing clothes was very difficult. It's been a bit of a roller coaster ride since I developed the BP. Nearly 8 years on, and I still live with the consequences of this condition. The disease has had a significant impact on my lifestyle, including the early retirement. It's very hard when you no longer have blisters to explain to some people, including my work's occupational health, that it's a bit more than just a bit of a skin complaint. For the last few years, I've been pretty stable, but tiredness is still a constant reminder that I'm living with an autoimmune disease. Steroid side effects have left me with diabetes and high blood pressure, but they saved my life. So finally, I'd like to say that quite a large part of my life is now taken up with managing the Pen Friends UK website, and helping others who have the same condition is one of my missions and can be very satisfactory. Thanks for listening.
Thank you, Ingrid, for sharing your story, and a big thank you to all of our panelists. We apologize for running behind schedule, but we do feel that these comments are important to share and to be heard for everybody in our community. Our panelists, again, want to say that your stories and your comments truly illustrate how the symptoms affect your day-to-day functioning and the quality of life learning to deal with these diseases. Your experiences also help to put into context how your disease affected you over time, which is important when developing new drugs for our diseases. Now, before we take a break, let's take our final poll of session 1. Thank you again for everybody for a great session. We will now take a 10-minute break. I know that we have inundated you with lots of information to process, so please take the next few minutes to let it all sink in, to get a snack or beverage, and we'll see you back in 10 minutes at about 5 after. Thank you.